Hello, my name is Sundip Karsan from the University of California, Los Angeles Gastroenterology Fellowship Training Program. It's my distinct pleasure to introduce Dr. Edward Huang today from Massachusetts General Hospital in Boston, Massachusetts. Today we'll be discussing an article by the core research group at the UCLA VA Center, titled The Impact of Nasogastric Lavage on Outcomes in Acute GI Bleeding Using a VA Database. I'd like to acknowledge the other co-authors on the study, Drs. Fasiha Kanwal, Inder Singh, Mark Makani, and our principal investigator, Dr. Brennan Spiegel. So, Dr. Huang, what was the reason for conducting this study?
The reason for conducting this study was to determine the effect of nasogastric lavage on important patient clinical outcomes. Many of us have learned in residency and GI fellowship that nasogastric lavage can be an important diagnostic tool in the management of gastrointestinal bleeding. However, as many of us know, it is very uncomfortable for patients and does not necessarily change our decision to perform an endoscopy. In addition, the guidelines from many societies do not have definitive recommendations on the use of nasogastric lavage. So because of this, we decided to conduct a study to determine how nasogastric lavage influence important clinical outcomes such as length of stay, emergent surgery, and blood transfusion requirements.
So how did you go about answering this question?
So to do this, we performed a retrospective analysis using consecutive patients that presented to the West LA VA Medical Center with GI bleeding between 1996 and 2005. We queried a database using ICD-9 codes consistent with gastrointestinal bleeding. And then all the physicians involved in the study confirmed the cases and collected the clinical characteristics from each case.
What were the outcomes that were addressed in the study?
So the outcomes addressed in the study included 30-day mortality, blood transfusion requirement, use of endoscopy, emergent surgery, and time to endoscopy.
So with such a large database with so many granular variables, one could imagine that there would be multiple confounders that could affect the results. How did you go about controlling for these confounders?
So an interesting part of the study was we used a technique called propensity score matching. Propensity score matching has been used in the past to quote-unquote mimic randomized control trials. So briefly what we did was we calculated the probability of each patient getting nasogastric lavage based purely on their clinical characteristics, regardless of whether or not they actually received the nasogastric lavage. Then we take each of the probability for each patient and matched it among patients who had actually received nasogastric lavage to those who did not. This is a complex technique, so we did include an appendix in our study that goes into further detail of this technique.
Excellent. So there's an appendix that someone can go to if they want to learn more about the statistical analysis portion of the study.
Correct.
So could you then move on to discussing some of the results of the study?
So using the propensity score matching to adjust for confounding, we found that the use of nasogastric lavage did not affect the 30-day mortality, did not affect the length of stay, did not affect the blood transfusion requirements or surgery. However, we did find that the use of nasogastric lavage did lead to more endoscopy being performed, and it also led to faster time to endoscopy.
Oh, very interesting. So, based on the results of the study, how then would we incorporate these findings into our clinical practice?
So prior studies have already shown that the use of nasogastric lavage can be important in detecting high-risk bleeding lesions, particularly active bleeding lesions. However, it's always been unclear if identifying those lesions led to any impact in patient outcomes such as length of stay and blood transfusions. So our study was able to answer that question, and we found that nasogastric lavage did affect the number of endoscopy performed, which is more, and also led to faster time to endoscopy. And although not confirmed in clinical trials, early endoscopy has been shown in the past to be associated with decreased length of stay and also reduced blood transfusion requirements. So based on this, I think the use of nasogastric lavage can be an important diagnostic tool in the management of gastrointestinal bleeding, leading to more effective and more efficient clinical decision making.
Excellent. So as we all know, no study is perfect. So to that end, what are some of the limitations of this study?
So some of the limitations of the study include the fact that we used the veteran populations, which is predominantly male and white, and so therefore this could limit the generalizability of our results to other populations. In addition, our study was retrospective in nature, so what that leads to is potential unmeasured confounding that was not adjusted for. In addition, there's always possibility for inaccuracies in the data collection due to the retrospective nature of the study.
Well, thank you very much, Dr. Huang, for sharing these very interesting findings with us. I'd like to also thank all of you for taking time to watch us today. Thank you so much.